Okay, live stream. Okay, perfect. Okay, so I'll say a few words in Hebrew and then I'll switch back to English. So ברוכים הבאים לכולם. היום אנחנו הולכים להעמיק באחד הנושאים הכי פחות מובנים בתזונה, הקטוגנית, בריאות הלב, קולסטרול, ואיך בשר עשוי להפוך להיות התרופה ולא הגורם לבעיות. האורח שלי היום הוא דוקטור פיליפ עובדיה, מנתח לב, שהפך לסוג של מורד בריאותי מטאבולי, ואנחנו עומדים לאתגר את כל מה שחשבתם שאתם יודעים על בשר אדום ועל הלב שלכם. דוקטור עובדיה הוא גם מחבר הספר Stay Off My Operating Table, שאני ממליץ עליו בחום, ועכשיו נעבור לאנגלית. Welcome, דוקטור עובדיה. Thank you for joining me today for my podcast. So I did a little introduction in Hebrew, but I'll say it in English too. I admire your work, and I read your book, Stay Off My Operating Table, and you are a cardiologist. I'll obviously let you introduce yourself in a second, a heart surgeon, and you have a little bit of a different view on the relationship between what we eat and our heart health, and this is going to be our focus today. So let's start by maybe you introduce yourself, not just the professional aspect, maybe a little bit about your personal introduction. So welcome again, and thank you so much. Please.
Yeah, thank you, Chef Oded. It's great to be here with you. Happy to be talking to you and your audience. You know, like you said, I've been a heart surgeon now for 25 years. I've performed over 3,000 heart surgeries. And during much of that time, I was a very unhealthy heart surgeon. I had reached a point about 10 years ago that I was morbidly obese. I was pre-diabetic, and I knew that I was going to end up on my own operating table, so to speak. And like so many of my patients, I realized that I didn't know what to do about it. I didn't know how to fix this. Despite all the education that I had received, you know, all the hard work that I had put into becoming a heart surgeon and dedicating my career to taking care of heart disease, I didn't know how to stop it. I had tried what I thought was the right thing: eat less, move more, eat a low-fat diet, all of that stuff that we've heard about, but it wasn't working for me and it wasn't working for my patients. And thankfully,
So you were
around that time,
one of those doctors that I come with a problem with my heart, and I see an obese cardiologist, and I'm thinking to myself, who is he to give me an advice?
Yeah, exactly. Quite, you know, I could do the surgery, right? I could do the technical part of fixing the heart, but I didn't, you know, it just occurred to me that why does it need to get to that point? We should be able to stop heart disease before it gets to that advanced point. And thankfully, I started to come across some different information, some different thoughts around what causes obesity, what causes heart disease, what causes diabetes, you know, all of the chronic medical problems that I was facing in myself and in my patients. And I started on a low carbohydrate diet, ultimately really went to a carnivore diet, a mostly animal protein based diet, was able to lose 100 pounds, maintain that weight loss. And that's important because yes, I had lost some weight before doing some of these other things, but was never able to keep it off. Would usually gain back the weight and more, as many of your audience is probably familiar with. And along the way, I came to learn that what I thought was the primary cause of heart disease, blood cholesterol levels, was not really what we understood it to be. And that this, you know, heart disease was a lot more complex than I had been kind of led to really think about. But on the positive side of things, it was also a lot more preventable than I had been taught to think about. So over the last 10 years or so, I've now kind of rededicated myself to keeping people off the operating table, empowering them not to need heart surgeons like myself, and really to not need physicians as much because most of the chronic medical problems that we suffer from here in the US and are the same ones that you guys suffer from over in Israel and worldwide, these are preventable and reversible diseases with a focus on diet and lifestyle.
Wow. So you touched a lot of subjects that I wrote down for us to talk about. But before that, I'm curious about how did your colleagues react when you started changing your views and lifestyle? Because it seems to me it needs a lot of courage to pretty much go against mainstream. Let's call it this way.
Yeah, the old saying goes, first they ignore you, then they ridicule you, and then you win. And that's sort of the stages I think that we're going through. Honestly, at first it just, oh, that's a fad, it will pass, it doesn't really work. And, now I get attacked somewhat online, but I don't really worry too much about it. What really saddens me about my colleagues, to be honest, today, most physicians have been disempowered. They can't think for themselves. They get told what to do. It's all about follow the protocols, follow the guidelines. And when you really look at, who those protocols, who those guidelines are helping, what you understand is it's not helping the patients and it's really not helping the doctors, right? The medical system as it is designed to take care of the system and to continue the system growing. And unfortunately, what we're seeing more and more is that the doctors and the patients are the ones that are suffering. The healthcare system, and again, this is a universal truth. This isn't US, Israel, UK, this is all over. I see it. The healthcare system has been designed to take care of sick people. And that's great. That's something that we need to do, but it doesn't have the capacity to say, how do we keep people from being sick in the first place? And we all would be so much better if we started with that question first. How do we keep people from getting sick so that you don't need some massive intervention like a heart surgery? So you don't need to be on medication for your entire life. How can you live a truly long and truly healthy life? That should be the question that the healthcare system is focused on. But in reality, what we have is a sick care system, and it's become very good at taking care of sick people. And yes, people with heart disease live a lot longer than they used to. People dying of heart attacks, it happens later in life, but it still continues to happen. Heart disease is far and away the number one killer. Here in the United States, every 30 seconds, someone dies of a heart attack. So we're not, the other concept is that we've made such great progress. I think back to when I was deciding what area of surgery I wanted to specialize in. And I decided I wanted to go into heart surgery, right? And this is, around early 2000s, so 25 years ago. And my mentors at the time said I shouldn't go into that. I'd be foolish to go into that because there was going to be nothing left for me to do in 20 years. And here we are 20 years later. I am busier than ever as a heart surgeon. Here in the US, we actually have a shortage of heart surgeons. We don't have enough to do all the surgery that needs to be done. And obviously, what we thought was going to be the cure to heart disease, lowering cholesterol levels with diet and medication, has not worked. And so it's time for us to step back and reevaluate, why isn't it working and what can we do better?
So let's talk about the elephant in the room. And I want to give you my personal example. I'm 51 years old. All my metabolic indicators are perfect. A1C, blood sugar, everything is right in line. And I also checked my heart and did the calcium score exam, the CT, and it seems perfect. And yet my LDL is off the chart, not by much, but still off the charts. And when I talk to my family physician, she is insisting on putting me on statins, saying that regardless to everything I just said, I'm in the perfect weight, I'm working out, I'm not smoking. Yes, I'm on the ketogenic diet, very flexible ketogenic diet. We'll talk about it in a second. And yet, only because this indicator this biometric, she's insisting, and a lot of cardiologists I'm talking to also, to put me on statins and force this LDL down because this is the evil, the problem causing, like, this is what we need to take care of. What if I came to your clinic?
Yeah. So, I have come to call this the LDL elephant in the room because that's really what it is. We have this concept that one number tells us everything we need to know about heart disease. And there's a couple of issues here that we need to unpack that most doctors, unfortunately, don't understand because they haven't been trained to look at the right test and to think about this in the right way. LDL cholesterol is not one thing. LDL cholesterol is a family of particles that transport cholesterol around our body. And yes, some of those particles are what we call atherogenic, meaning that in the right environment, and this becomes important as well, they can contribute to the formation of plaque within our blood vessels. But in and of themselves, a high LDL cholesterol level does not cause heart disease. It's part of the process. So the environment is important, and that starts to get at some of the things that you talked about: metabolic health, insulin resistance, inflammation. We need to know about those things. And then also recognizing that not all LDL cholesterol is actually atherogenic. We have, broadly speaking, a couple of categories of LDL cholesterol that we put the molecules in based on their size and their density. We have what are called small dense LDL particles. These are atherogenic particles that can be problematic. But we also have what we call large fluffy or large buoyant particles that are not atherogenic. And if you're just looking at your basic cholesterol panel that just reports your LDL, you don't know which ones you have. And this can get you in trouble in both ways, because someone like yourself that has what's considered a high LDL level, there's a very good chance that most of that LDL cholesterol is the large LDL cholesterol particles, and therefore are not atherogenic, and there's no reason to worry about it, and there's no reason to put people on medications that can have side effects over a lifetime. The other side of the problem is even more problematic. You can have what's considered a normal or a low LDL cholesterol level, but because you have insulin resistance, because you have inflammation, most of those particles are small particles. And you and your doctor are falsely believing that, you're not at risk because your cholesterol is controlled. But those are patients that I see ending up on my operating table over and over again. Realize now that at the point that we're at is the majority of the patients that end up on my operating table, they've been on cholesterol lowering medications, sometimes for decades, and it hasn't stopped the progression of the disease. And we're not looking at that. We're not measuring it correctly. And most doctors, again, haven't been taught to go beyond the basic cholesterol panel and figure out what's actually going on in that patient's heart and in that patient's body.
So if I'm the average person and I wanted to have a conversation with my physician and maybe ask for other tests or other indicators that I can check to make sure that I'm not at risk and I don't have to take statins, maybe you can help me understand what other things I can check to, not for my physician, for myself, of course, to make sure that I can live with high LDL, and not worry about maybe getting a heart attack in the next 10 years.
Yeah, so the first one is a test you already mentioned that you had gotten, the coronary artery calcium scan, CAC scan. This is a simple, non-invasive test. It's an X-ray test. It's what we call a CAT scan, a CT scan. Takes about 5 minutes. They don't even need to put an IV in you. And it's usually a pretty inexpensive test. Here in the US, you can usually get it done for somewhere around $100. And this shows you disease, right? Understand the blood work is trying to help us understand the risk of disease, But this is actually showing us, do you have calcified plaque in the arteries of your heart? Do you have disease? And then we can use that over time to be following the progression of your disease. Are you getting more plaque or not? At a high level, if you have zero calcified plaque, if you have a CAC score of 0, your risk of having a heart attack over the next 10 years is very low. It's a little bit age dependent. It's more meaningful, the older you are. But, someone like yourself, 51 years old, 0 CAC score, we know that you are at low risk of developing a heart attack over the next 10 years. And we know that lowering your cholesterol is not going to change that risk. The studies on that have been done. And so, that's a great starting point. Even if your score isn't 0, though, it turns out that lowering cholesterol with statin medications is not the answer, because that has actually been shown to make your calcified plaque, your CAC score, go up faster over time. So that becomes a problem as well that we need to talk about. So part 1 is, let's actually look at the disease instead of just looking at the blood work. And then when you are looking at the blood work, you want to look at some different things. You want to try and get the what we call an advanced lipid panel. See what type of cholesterol, what quality your cholesterol particles are. And then look at those in what we call sort of the environmental factors that are going to determine whether or not the cholesterol will become problematic. Do you have insulin resistance? Do you have inflammation? And so, there are a couple of different ways of testing all of that. The most common ones that I see are on the inflammation side of things. We have what's called CRP, C-reactive protein. That's a general whole body inflammation marker that gives us indication about heart disease risk specifically. And then for insulin resistance, the most basic way to start is just if you know your fasting glucose level and you know your fasting insulin level, you can use a calculator online. It's called HOMA. You just plug in your numbers, you're going to get a HOMA IR score that's going to give you an indicator about whether or not you're insulin resistant. But, the general concept of you want to have a normal glucose level with a low insulin level, that tells you you're in a good spot.
How about lipoprotein A, ApoB? What else I heard from other patient that their doctor maybe we can eliminate more risk. Are those necessary as well? How about the ratio between my HDL and my triglyceride? Does that tell me anything?
Yeah, all good questions. So, ApoB, apolipoprotein B, is kind of replaced LDL cholesterol as the preferred blood measure. But ApoB suffers from the same problem that LDL cholesterol as a measurement does. ApoB counts not only your LDL particles, including both the small and the large LDL particles, but it also counts some other atherogenic particles that can accumulate. These are what we call VLDL, very low density, and IDL, intermediate density. And yes, again, those particles are atherogenic and can be problematic. But if someone has an elevated ApoB level, we still don't know. Do you have a lot of the large, non-problematic LDL, or do you have a lot of the small LDL, the VLDL, the IDL that are all atherogenic? So you still got to go beyond ApoB. Now, Lp(a), lipoprotein A, is its own risk factor for heart disease. Lipoprotein A is an LDL molecule, but it's got this extra protein on it. That's what the lipoprotein A is. And what that protein does is it now causes that LDL molecule to interact with the blood clotting system. I tell people to think of it as it becomes a more sticky LDL molecule, and it can start to form some blood clots. And those blood clots are what can then lead to trouble with heart disease. And so Lp(a) is something that people should know about, but it, again, is not a problem because it's cholesterol. It's a problem because of blood clotting predisposition And therefore, you have to do some different things to help guard against the effects of Lp(a).
I understand. So after all that being said, who is actually a good candidate to start taking statins? I mean, is there a really way to avoid it, or you see cases that you say, okay, there is no choice? I mean,
yeah. So first of all, no, I never say there is no choice, right? Because we always have choices in life, and everything we do in medicine should be about choices, but understanding what are the risks of those choices, what are the benefits of those choices. So who benefits from taking statins? The patients that benefit from taking statins are the patients that have inflammation, they have insulin resistance, and they have the poor quality cholesterol molecules. They have a lot of the small, dense LDL and a lot of the VLDL. Yes, those patients are going to get a small benefit from taking statins. And so understand that the benefits are nowhere near as large as people get led to believe, but there are some benefits. Now, there is a much greater benefit to getting rid of the insulin resistance, getting rid of the inflammation, shifting the cholesterol particles so that they are the larger cholesterol particles. And we now know that that's very possible to do. And, the way to do that is by changing what you eat and how you live. Ketogenic, low carb, carnivore diets are great at accomplishing all of those things that we just talked about. So now the choice really becomes, do you want to change the way that you eat and live, improve your overall health, feel better, get all the benefits that I'm sure you've talked about on this show many times from doing a ketogenic diet? Or do you want to take this medication that, yes, it's going to lower your risk of heart disease a little bit over your lifespan, but it's also going to increase your risk of other problems. And again, this isn't an attack on statins. All medications have side effects, and the longer you take them, the more likely it is that you're going to get some side effect. But to me, the side effects from statins become more and more concerning over time. So if all your doctor can say is, well, your only option is taking this medication, it may be time to find another doctor, because there are other things that you can do. And the final part of understanding all of this is, once you've eliminated the insulin resistance, once you've eliminated the inflammation, you're probably no longer going to benefit from taking that medication. So why expose yourself to the potential risks?
Okay, so let's talk really about the preventive stuff. And, you and I understand the keto diet, the low carb, but the question is, does eating red meat raise the risk of heart disease / cancer? I mean, if you go online and Google red meat, oh my God, you say, okay, I'm convinced, doctor, I'm with you. But now I have another issue that everybody tells me red meat is going to cause damage and heart disease and maybe even cancer.
Yeah.
So what is the real data
Well,
showing?
the real data shows that no, red meat is not a risk when it comes to either heart disease or cancer or really anything else. And yes, you're exactly right. You get a very different impression when you go online and look up that question. But no matter how many times a lie gets repeated, it doesn't make it true. And we now have many recent studies that start to undo this lie. And we need to understand that the studies that this, we'll call it false belief, came from in the first place were just lousy scientific studies. They are all what we call epidemiologic studies, which means you take a large group of people and you ask them questions about what they do, how they live, what they eat. And you try and figure out, what might be causing some of their health troubles. But there are problematic, things about this method of science, right? It's not even necessarily about the individual studies, although sometimes it is. But this method of science as a whole, it can't prove what we call causation. It can only show correlation. So, getting specifically to the red meat issue, what happened was, you go back to the 1960s, the 1970s, and this concept about cholesterol, dietary cholesterol, which is in red meat, saturated fat, which is in red meat. It was thought that this was the problem when it came to heart disease. And they did some of these studies. And yes, in some of them, you can show that people that eat red meat were having higher risk of heart disease. But the problem becomes that, people were told not to eat red meat. So the ones that were eating red meat weren't listening to health advice, and they weren't doing other things, right? Like they smoked more. They didn't stop smoking like they were told is good for their health. They didn't exercise as much. There may have been many things about their life that caused them to be more unhealthy. And what we now recognize is that, when most people say they eat red meat, right, the most common thing is they're eating a hamburger and they're having the toppings, they're having the bun, they're having the French fries with the hamburger, and they're probably drinking a sugary soda with that hamburger. So when that's true, you can't go and say, well, it was the red meat in the hamburger that caused the problem. But that's what these scientists who, came into it with their own biases wanted to say. They said, obviously, it's the red meat, and they ignored everything that was being eaten with the red meat. We now have better epidemiologic studies that have shown that no, red meat is not an issue when it comes to both heart disease and cancer. And more importantly, we have a higher level of science, things that are called interventional studies, also showing these things not to be true. So the bottom line, and I know this is hard because it has been repeated over and over again for, 50 plus years now, but it was never true in the first place, and it's still not true. I am perfectly comfortable as a heart surgeon, as a doctor who takes care of the heart, telling people you can eat all of the red meat you want. You just can't have the sugar and the processed food with it, like most people do.
So why do you think the low-fat myth refuses to die even in 2025?
Yeah, I think, it's just so ingrained in the system. And there are a couple of aspects of this. Number one is that, yes, we have a huge, highly profitable pharmaceutical industry behind this, right? Cholesterol lowering medications are one of the most widely prescribed class of medications, and they generate a lot of profits for the pharmaceutical industry, and we can't ignore that. So that's part number one. Part number two is doctors and the healthcare system as a whole, they don't have any other answer to heart disease, right? And again, this is where I come back to, doctors being disempowered because they haven't been taught about metabolic health. They haven't been taught about insulin resistance. So if they say to the patient, well, cholesterol lowering doesn't really work, they're left with, I don't have any answers to your problem. And, doctors do want to help their patients, right? They do want to do something that they believe is, lowering that patient's risk of heart disease. Doctors like myself who have come to understand the importance of metabolic health, of insulin resistance, can help. We do help our patients. And it's not a matter of, and this is something else that, kind of gets misframed when it's being discussed. I'm not telling people to ignore their cholesterol. I'm telling them to manage what are the true root causes of heart disease, insulin resistance and inflammation. And when they do that, their cholesterol is no longer harmful. So that's why we don't need to treat it. We don't need to lower it. We are putting our bodies in a place where, heart disease is not an issue. So we don't have to worry about preventing it with these medications that don't actually prevent the disease.
So maybe you can share with us, what is your current diet
so
look
I
like?
am largely on what would be called a carnivore diet. I eat almost exclusively animal proteins and the fats that come with it. I eat a lot of red meat. I eat a good amount of seafood. I eat some other meats as well, and not a whole lot else. Occasionally, I'll have some other, what would be considered whole real food, maybe some vegetables, maybe a little bit of fruit here and there, but the vast majority of my diet on a day-to-day basis is a carnivore-based diet. I've been doing low carb keto more broadly, right? And understand that carnivore is a subset of low carb ketogenic diets. But I've been doing low carb ketogenic diets for about 10 years. And I've been on this primarily carnivore diet now for about 7 years. And I remain in the best health of my life. I've been able to keep the weight off that I had gained, more muscular, more energetic. And like you, despite having an LDL cholesterol level that is alarming to most doctors, I've had 3 coronary artery calcium scans now over about the past 8 years. They all remain 0. I'm actually the same age as you, 51. And so everything looks good from my perspective regarding my health.
Wow, amazing. So there's a lot of talk about the saturated fat versus unsaturated fat, and maybe it's just my feed, but every day I see stuff coming up because we know that by switching to animal-based diet, obviously we're going to eat more fat and very, very low carbs, sometimes even 0. But then the question is saturated fat is the answer for that? And what do I need to pay attention to? Because if I go to the supermarket, half of the stuff has seed oil fats and all that stuff. What's your take on
so
that?
again,
Right?
saturated fat is not the problem, never was the problem. And this, again, this, mistruth, this lie, this one's actually been sort of corrected by the medical authorities, right? So the U.S. dietary guidelines, which were the first, government issued dietary guidelines in the world, and the ones that really initially put the concern around saturated fat and limits of saturated fat, they have actually removed the limitation on saturated fat. They have specifically said that saturated fat is not a nutrient of concern. The American Heart Association has done similarly, but they've done this very quietly. They haven't publicized the fact that they made a mistake in telling people this in the first place. So there are no longer limits on saturated fats. And that's because, again, study after study has shown us that saturated fat, natural saturated fats coming from things like animal products, are not a problem. Now, polyunsaturated fatty acids, what are called PUFAs, these are what are in vegetable and seed oils. They are actually problematic. And I do believe that they should be eliminated as much as possible from our diet and our food supply. It's interesting. The only reason that they were thought to be beneficial was because they lower LDL cholesterol levels. However, those same studies that showed that they lowered LDL cholesterol levels did not show any benefit for people living longer. And a few of the studies actually showed that people lived shorter when they replaced the saturated natural fats in their diet with these industrialized polyunsaturated fatty acids, these vegetable and seed oils. Now, there is a little bit of a caveat, I guess, that people should understand about this. There are some naturally occurring polyunsaturated fatty acids. When you're eating animal products, you're going to get some of those, right? Beef, seafood, lamb, chicken, pork, they contain some polyunsaturated fatty acids. Now, at low levels, that's not a problem, but it can become a problem. And it becomes a problem when that animal is not being fed its natural diet, right? We talk about all the processed food that humans are eating and why it's become problematic for us. What we sometimes don't talk about is a lot of the animals are eating processed food and it's a problem for them. And then when we eat those animals, it becomes a problem for us. So you do want to be a little careful about this. And it turns out that this is more of an issue for what are called non-ruminant animals, animals that only have one stomach, things like chickens, pigs, humans, by the way, not that hopefully anyone's eating those, but, whereas ruminant animals, things like a cow, beef, they have a little bit of capacity to sort of detoxify these things. They can convert unsaturated fats back to saturated fats. So while it's still an issue and, you do want as best as you can do to get higher quality meats and higher quality beef that are fed well, you're safer. It's not as much of an issue if you have a poor quality fed beef as you do if you have poor quality fed, chicken, eggs, etc. That is a nuance.
This is a very, very important nuance, especially since recently, again, there's a lot of talk about grass-fed and not grass-fed. I did a previous podcast with my friend who owns a butchery here and is a big meat supplier here in Israel, and he explained that very well. But I totally agree. I think when talking about beef, we have less to worry about. And also, the grass-fed now is being used too much. We're really looking at grass-finished, because even if the cow is grass-fed and then it's being fed before butchery, different food, but this is a whole different subject. But my other question is, and maybe you can share from your own experience, when I'm switching to such a diet, which the way I call it, it's starting with an elimination diet, because when we switch to animal-based keto, first we eliminate a lot of the things we used to eat, which is great. Do you think we can get everything we need from the food, or we need to also supplement with maybe vitamins, minerals, amino acid? I mean, because if we're talking about the medication industry, the pharmaceutical, wow, when we're talking about supplements, this is a whole different zoo out there. And I think, and I feel like people get really lost there.
And this is one of the most powerful things about eating a animal-based diet is that, yes, we can get everything that we need from the meat, from the animal. This is how human beings evolved. We evolved eating a primarily animal-based diet, and it makes sense that our bodies have adapted and been optimized for eating that type of diet. So you contrast that against a vegan vegetarian diet, right? And I always tell people that if you're doing a vegan vegetarian diet that eliminates processed food, very important because a lot of them don't. But if you're truly eating whole, real foods, right? You're just eating fruits and vegetables. Yes, you're going to be in a better place than you were on the standard processed food diet. But you have an issue in that plants alone cannot provide all of the necessary nutrients, amino acids, minerals that humans need to survive. There are some unique things that are only available in animal products. These are things like vitamin B12. These are things like vitamin K. The amino acids in plants are incomplete, whereas animal proteins have the complete spectrum of amino acids that we need. So this is what favors eating an animal-based version of a whole food, non-processed diet. And personally, I don't take supplements on a regular basis. Most of the carnivore community that I know is similar because we get everything we need from the meat that we're eating, and there's just no need for extra supplements.
Interesting. I can share myself, and I shared it more than once. I do take some minerals, especially when I work out more. And now in the Israeli summer, I feel like I need, some magnesium and potassium and some rehydration. I do take creatine, which, as far as I research, is the most researched supplement out there. And I do feel the change when I start working out more. But other than that, I'm with you 100%. I feel like the food I eat should give me everything. Although some people will say, the body is not the same body.
Yeah.
The cows are not the same cows. So maybe there is room to that. And I think we just need to check it. I always say about supplements, if you take something just because someone said and you don't know the effect and you can't measure the effect, so what's the point,
I think
right?
that's exactly the way to think about this. And I do think, yes, if you're, in a hot environment, you're sweating a lot, you're exercising a lot, taking some electrolytes and minerals may be a good idea. Creatine is a real interesting one. And you're right. Creatine is probably the most, if not one of the most researched supplements, pretty consistently shows benefits, both in terms of muscle building as well as perhaps neurocognitive functioning, and, doesn't seem to have much in the way of side effects. Now, understand that if you're eating a animal-based diet, you're probably getting a pretty good amount of creatine in your diet. So you may not need to be supplementing it. You're already supplementing, I guess, is one of the ways to think about this. And to my knowledge, all of those studies done on creatine supplementation that show benefit are, none of them are done specifically in people eating carnivore diets. What I can say at a high level is I know a number of carnivores who, are pretty intense on weightlifting and muscle building and don't supplement with creatine and are doing just great. I also know a lot of people who use it as a supplement regularly and seem to gain some benefits from it. And like I said, it really doesn't seem to have anything in the way of side effects that are significant. So it is one that I end up recommending more and more often, but I also don't consider it to be essential. I know that you can thrive on a low-carb carnivore diet without supplementing creatine.
There is this myth, although, that, it's harder to build muscle mass when you're eating almost zero carb. I don't know. I mean, this is ongoing debate.
I think that
I really don't know
I think
what's
we
the
do
right
know
answer.
the right answer, honestly, on this. I think that is a myth, and it is absolutely not true. And I know, again, many high-performing people in the sort of muscle building world, we'll call it, bodybuilding and all of that do so on low-carb diets, and they do just great. The one thing that people do need to understand is, from an athletic standpoint, if you're transitioning to a low carbohydrate diet from a high carbohydrate diet, there is a transition period. This is something, that we shouldn't deny, shouldn't ignore. It can take a month, it can take a couple of months for the body to adapt to this new fuel system, basically, right? You're switching the car from gasoline to diesel, and that takes some adjustments, right? And if you just put the diesel in the gasoline engine, you're going to have trouble. You need to, your body needs to undergo some adjustments. And that is a very real concern, especially if you're a high level athlete. If you're not, right, yes, you could have a little bit of symptoms. Some people get headaches, and you'll hear it called the keto flu. And again, that is a very real thing, but it's also very easy to manage. You take some extra electrolytes, you stay well hydrated, and your body is adaptable and will adapt. But, it can take a couple of weeks to do that. So I think it's important for people to understand that. But that doesn't mean that one is better than the other. Although actually I do think one is better than the other. I think our bodies actually do work better in a ketogenic metabolism. It's just when you're doing a study like many people have, where you only look at this in the first couple of weeks, it can make it look like the ketogenic diet isn't as good, because some people are going through this transition. But when you take athletes who are keto adapted, fat adapted, we call it, they've been doing these diets for longer periods of time, you cannot show any difference between how they perform on ketogenic diets versus on high carb diets.
I agree. And I think that the definition for ketogenic diet is very broad, because when you say I'm on the ketogenic diet, like for myself, I go in and out of ketosis all the time, because I don't believe that someone that is healthy needs to be 100% of its time in ketosis. And a lot of the research that's being done are taking people, like you said, that just switched and they want to stay on the ketosis metabolic stage forever, which I think also is a misconception about our diet, because the ultimate goal, as I see it, is to become metabolic flexible. And we don't need to lose our ability to work on glucose if we switch to ketogenic diet. And this is where a lot of people, I think, make a big mistake when they're switching and thinking, that's it, I don't want to leave, this comfort zone forever.
I think there is something to that. And again, I think this does get sort of misperceived both ways, right? Because you are perfectly correct that someone that is on a low carb carnivore, ketogenic diet, right, if they eat some more carbohydrates, it's going to take them out of that ketogenic metabolism for a little bit of time. And that probably is not going to be harmful depending on your circumstances, right? I always tell people that, if you're insulin resistant, your body does not process carbohydrates properly. If you've overcome that insulin resistance and, you're active and you're, doing okay otherwise, yeah, a little bit of carbohydrate isn't going to kill you. It's, we don't need to fear the natural carbohydrates as much as perhaps some people do. But on the other hand,
right,
they do not provide any unique benefits nutritionally. So you certainly can stay in that ketogenic metabolism for long periods of time without coming out of it. This again is, find what works best for you. There are some people, for instance, that have pretty significant autoimmune disorders, and even little bits of plant products and carbohydrates can kind of set them off or set them back. And those people can and may need to stay on a very strict kind of carnivore, very low carb diet. And it's perfectly healthy to do that. So I want people to understand that they have that option. But you're right. Most people, you can kind of go back and forth a little bit, and you just want to keep an eye on the right metrics to make sure that you're not getting back to the insulin resistance that got you in the trouble in the first place.
Yes, I almost, the analogy I have in mind is almost like, are you doing this keto diet as a recreational or as a fix to a medical situation? Those are two different aspects of the diet, because a lot more and more people I meet, especially young people now here in Israel, they want to experience the benefits, not just for weight loss or heart health, the cognitive, the focus, the ease of just living in such a easy way. And really, there is a big difference between, are you starting this diet as a healthy person, or are you starting this diet with insulin resistant and everything you said? I think it's a very good point to emphasize. We have maybe a few minutes left. So I want to ask you again on a personal note, what's the mission that keeps you going? And also, are you optimistic about the medical system that can ever change, or people really have to take control of themselves and take care
again, the
of
mission
themselves?
that I'm on is empowering people to stay off the operating table and allowing them to take back control of their health, like you said. I am actually optimistic that the medical system is starting to shift. I think doctors are becoming increasingly frustrated because of the results that they're seeing, right? The doctors are recognizing that, wait, we've been using these medications that were supposed to be the cure for heart disease, and heart disease is getting worse, and that's just unsustainable. From a purely financial standpoint, right, we're recognizing that our current healthcare system, and again, this is not, specific to any country. We've been seeing this universally, right, that countries are being bankrupted by, the cost of taking care of sick people. And the only way we're going to fix that is by getting less sick people.
Yes.
And so those forces are inadvertently, kind of helping our cause. And I am optimistic, the low carb ketogenic diets are becoming better and better accepted within the healthcare community. I go to conferences, I see more and more doctors, more and more practitioners of all sorts that are interested in this and starting to implement it into their practices. So that does give me hope that we are going to be able to turn this around. Here in the US, this has become a national issue. It was a large focus of the presidential election last year, and now of the administration, with the great work that Robert Kennedy is doing to try and influence and try and start to change some of these things on the systemic level. But I always tell people, don't wait for that, right? You take control of your health. You make the choice to start eating differently and living differently so that you aren't as dependent on the healthcare system anymore.
Yes, amazing. Dr. פיליפ Ovadia, if people want to follow you, learn from you, where can they find you and get more knowledge out
Yeah,
of
thank
this
you. So
amazing
at
work that you are doing?
iFixHearts everywhere on social media, all the social medias, you can go to ifixhearts.com. My book, Stay Off My Operating Table, widely available at all the usual places. And we have a telemedicine practice that sees patients throughout the United States and internationally. So if people are looking for, healthcare practitioners that are awakened and aligned to this way of thinking, come to ifixhearts.com and see if we might be a good option for you. That type of stuff done.
Amazing. Dr. פיליפ Ovadia, thank you for making steak cool again. I really appreciate your time, your fire, and everything you're doing for real health. I always learn something new from you, and I feel blessed to have you on this show. So thank you so much for your time, and I'm sure there's going to
Thank
be
you,
a lot of
Chef. And,
follow-up on that
thank you
conversation.
for all the great work that you're doing, building a strong community around this in Israel. It's been a real honor and pleasure to get to know you and collaborate on some things with you. And we just need to all keep spreading this message.
Absolutely. Absolutely. Thank you so much for your time. Bye-bye.